Hey friends, Andrew Herrera here with an exciting update from Curamericas Global. Before I share some really good news, I want to say thanks. Because of you as a member of the internal team and family of Curamericas Global, we've been continuing to grow our impact around the world and right here in North Carolina. 2020 has been a really hard year. It's been hard for all of us for different reasons. But Curamericas Global has successfully deployed 180 community health workers across North Carolina. Despite all of the challenges, we've been able to reach more than 70,000 people in just a few months. Thanks to the tireless work of our partners and these community health workers, I am so thrilled to share with you that the state of North Carolina has asked us to continue this work. The state of North Carolina is pleased and excited about what Curamericas has been able to do. And so we'll continue to reach the hardest to reach and often forgotten people across the state of North Carolina in rural populations and urban centers. We'll be working to not only connect people to resources and make sure they have the right information, but we're working on distributing the vaccine information and making sure people get their booster shot. It's a important system that we're part of, and the state of North Carolina is depending on Curamericas' continued expertise and support of community health workers. And so, in partnership with Duke University, Gang Free and Green Rural Redevelopment Organization, El Centro Hispano and La Semilla United Methodist Church, St. Julia AME Zion Church, and many other partners, we quickly stood up to go out into communities, to not wait for them to come to the hospital or the emergency department, but to look at what can we do to prevent emergency situations, to keep people safe and connected to resources in their community. The work continues to evolve, but I want to share one story that I think is important about what we're supporting. A health department person in a rural county in North Carolina called a community health worker almost in tears because a landlord was getting ready to evict 8 families with kids due to the inability to pay rent because of COVID. The health department didn't know where to turn, so they asked the community health worker, "Can you help?" This amazing community health worker would not give up. And so he used his network to identify resources quickly. Working with local churches in this community, he was able to raise money, over $2,000, to help prevent these 8 families from being evicted. The reason community health workers are so effective across the world and here in North Carolina is because they are from the community. They speak the same language as the community. They sit and they stay and they pray with the community. They're trusted, they're trained, and they're compassionate. Curamericas is committed to the last mile, getting health into the hands of the people who need it most. We have a lot of responsibility in 2021, and we're excited about this new opportunity with the state of North Carolina to continue our work. It speaks to our experts, and it speaks to our partners, and it speaks to the need in the community today. Keep fighting. Keep working with us. We need your help. 2020 is almost over, and 2021 surely must be better. Again, thank you for being part of this. Happy holidays.